Hello. Now we're gonna speak about the stomach. We're gonna start first with the divisions of the stomach. We've got the first part, which is the cardia, and it is dome-shaped, projects upward. It is always filled with gas. After that, we've got the body of the stomach, which extends from the cardia orifice down to the incisura angularis, which is around here. It's a notch. It's a constant notch in the lesser curvature of the stomach. After that, we've got the antrum, which is this part. Extend from the incisura angularis down to the pylorus, while the pylorus region is the most tubular part of the stomach and contain the pyloric sphincter, which is an anatomical sphincter. That means it is made of muscle, a thickening in the circular muscle of the stomach. Now, we've got the rule of two, and that means we've got two openings, the cardiac orifice and the pyloric orifice. We've got a sphincter, which is a physiological sphincter around the cardiac orifice, which prevents regurgitation of food back into the esophagus. And down the stomach, in the stomach, we've got the pyloric orifice, which got an anatomical sphincter that prevent the food from regurgitating back from the duodenum, as well as controls the rate of emptying of the stomach. That means when the food enters the stomach, it needs to be digested, and then after that will pass down to the duodenum. And after that, we've got two curvatures, which is the lesser curvature and the greater curvature of the stomach. We've got also two surfaces, the anterior surface and the posterior surface. After that, we'll speak about the relations. We'll speak about the relations of the stomach. First, we've got the lesser omentum, which extends from the lesser curvature of the stomach upward to be inserted into the liver. And we've got the greater omentum, which extends from the greater curvature of the stomach downward, overlaying the small intestine, then back upward to be inserted into the transverse colon. We've got also another thing. It can't be seen here, but there is an extension, a ligament, which extends from the stomach back to the spleen, called the gastrosplenic ligament. Now, the anterior relations. We've got the first thing is the anterior abdominal wall. After that, we've got the left costal margin, which is this. It overlays the muscle. And we've got the left pleura, which is this transparent sheet that also overlays the stomach, which contain also the lung. And we've got the diaphragm, which is this muscular part, and the left lobe of the liver. Now, let's continue the posterior relations of the stomach. The posterior relations of the stomach, we've got the lesser sac, which is somewhere here, and the opening would be between the lesser and the greater omentum here to the lesser sac, which is behind the stomach. We've got the diaphragm also extends backward around it, and the spleen, which is this organ, and the splenic artery, which is this organ, this artery, the suprarenal gland, the left kidney. We've got the pancreas, the transverse mesocolon, which can't be seen here, and the transverse colon. Now, to the blood supply. Now, the blood supply, everything that is superior, we call it left, while the inferior arteries or veins are called the right. So, first, we've got the left gastric artery, which is a branch from the celiac trunk from the aorta, which supplies the lesser, the upper portion of the lesser curvature, and while the lower portion of the lesser curvature supplied by the right gastric artery, which is a branch of the hepatic artery. Now, to the opposite side, we've got the left gastro-omental or epiploic artery, which supplies the greater curvature, the upper portion of the greater curvature, and as well as the right epiploic artery, gastro-epiploic artery, which is a branch of the gastroduodenal branch of the hepatic artery. That is somewhere. Oh, there it is. Can't be selected. No. We've got we've got a short artery, which is the short gastric artery, which supplies the fundic region, as well as the anterior surface. As for which is a branch also of the splenic artery, while the veins are the same, with the short gastric vein supplied by the splenic vein, back to the splenic vein, while the left gastroepiploic vein drains to the to the splenic vein, which all drain back to the portal vein here, while the right gastroepiploic vein drains back to the superior mesenteric vein and then to the portal vein. As for the left one, the left gastric vein drains down directly to the portal vein. The right gastric vein also drains directly to the portal vein. While the lymph node, it's all drains back to a lymph node that surrounds the celiac trunk, so it's called the celiac lymph node. While the nerve supply, we've got a sympathetic fibers for the pain and a parasympathetic fibers, a secretomotor part. We've got the anterior vagus and the posterior vagus. The anterior one is the left vagus. After entering the abdomen, becomes the anterior. it becomes the anterior, while the posterior is the right vagus. The anterior vagus will supply all the anterior surface of the stomach and give a branch to the hepatic branch or large hepatic branch around the artery, continue with the artery to the liver, and the pyloric branch to the pylorus. And the posterior vagus supplies all the posterior portion of the stomach, and then it is important, it gives a branch to the celiac artery and continue down into the abdomen, as well as a branch to the superior mesenteric artery. Superior mesenteric artery, which continue downward as a plexus and gives innervation to the small intestine. That's it.